21st century is the century of globalization. The world is changing, and India is not an exception. Advent of the global economy has opened new vistas in the area of healthcare also. India is fast emerging as a desired destination of medical tourism. Modern hospitals are providing healthcare of international standards. As a result, the role of healthcare professionals like pharmacists has also changed. The pharmacist is no longer just a supplier of medicines and a concoctor of medicinal products. Instead, his role now involves being a member of the team providing healthcare, be it in the hospital or in the community pharmacy, the laboratory, industry, or in academic institutions. However, in India, the general perception of the pharmacist is that of a person who just counts out and provides medicines, who tells how and when to use the medicine, a shopkeeper or a businessman, and one who has little to do with healthcare practice.
Pharmacists in India are a very critical component as healthcare professionals. Just like we have nurses, we have physician assistants, surgical assistants, diabetes educators, dietitians. I think pharmacists form the most important core whenever healthcare delivery system is there. And in India, unlike the West, chemist has a huge role to play. Sometimes he is one of the most trusted confidants both of the doctor and the patients. In fact, according to me, in the chain of healthcare system in India, pharmacist is very pivotal. You may not know, but 1/3 of people in India are pharmacists who are healthcare professionals. And pharmacists actually provide the first contact with the patient when he goes with a prescription from a doctor so that he can take medicines. And that is why the role of pharmacist as a healthcare profession in India is a trusted companion. Pharmacists not only have educative value, but they are very important in telling the patients how to store medicines, how to take medicines, how to take them in the right proportions, and so on and so forth. So they just don't do the job of delivering the goods, they also do the job of educating.
If you involve pharmacists in the day-to-day healthcare system, it makes a great role they can play in helping doctors to manage or helping country to take care of the various common respiratory disorders.
In a country like India, where women are quite inhibited, they're quite shy, even to talk to their physician about their problems, the pharmacist plays a very important role, because the woman often interacts directly with the pharmacist, and many of their problems can be conveyed to the pharmacist. They can talk about some issues like menstrual problems, some diseases, even cancers. When they are asking for medicines to the pharmacist, they can discuss these issues. And if the pharmacist is well educated, well informed, they can help the woman in a lot of these issues about menstrual hygiene, about consulting and doing proper testing for cancers, preventive care, nutritional matters. So a lot of this can be dealt with by the pharmacists. If a woman is pregnant, they can recommend good nutritional supplements, they can advise about care during pregnancy, and later on after delivery they can even recommend that the child should take proper immunization. So at various levels the pharmacist can play a very important role in communicating with the woman and ensuring her good health, because that eventually translates into good health for the entire family.
Apart from the general perception of a pharmacist, there are several other real challenges too. Owing to huge population, the role of pharmacist both in community and hospital pharmacy is not clearly defined. We still have wide rural setup with minimum facilities, just contrary to developed nations. Poor educational standards is another challenge. Community pharmacists have little knowledge of clinical pharmacy. Shortage of quality pharmacists, lack of communication with patients due to use of many languages. Apart from these challenges, illiteracy of the population, non-availability of basic drugs, rampant quackery, vast number of drugs and availability of irrational combinations, weak drug regulatory authority, and poor coordination between pharmacist and the physician are other challenges which pharma sector has to overcome in order to transform the face of pharmacy sector in the country.
It is very important that the pharmacist should be having good communication skill, good subject knowledge as well. If you are having good communication, but no subject knowledge, again that becomes an hindrance or barrier as far as the communication is concerned, right. So, you should have good communication, good subject knowledge, good demeanor. You should be more proactive and more and you should be more empathetic to the patient, means you feel at the patient's place, and then try to understand the situation, that if you were a diseased person in place of the patient, how would you feel like.
They can understand the drugs what are given and what are the side effects, and can tell the patient, no, you stop the medicine and go back immediately to a doctor. They also can tell us regarding allergies which are patient developing before doctor come to know. So, being the patients, you can say the pharmacists are not only they are a first person to interact, before some time doctors interact with the patient, and also not only that, the medicines which are delivered to the patient, the pharmacist can help to improve the compliance of the treatment.
Pharmacist has to look at the storage component, the cold chain component, the reliability component, and they also are often plagued with problems like counterfeit drugs, spurious drugs, so on and so forth. So, I feel pharmacists are the true gatekeepers of an important cog in the healthcare system.
Challenges are nothing but opportunities in disguise. This is equally true for the emerging pharmacy sector of India also. We already have a framework of good pharmacy practice set up by WHO, National and International Healthcare Organization. First of all, we must know what really is good pharmacy practice. It is clear that good pharmacy practice, or GPP, is the practice of pharmacy that responds to the needs of the people who use the pharmacist's services to provide optimal, evidence-based care. In order to support this practice, there are established national and international frameworks like legal framework, workforce framework, and economic framework. These frameworks define that core of pharmacy activity is to help patients make the best use of medicines through the supply of medication and other healthcare products of assured quality, the provision of appropriate information and advice to the patient, administration of medication, the monitoring of the effects of medication use, the promotion of rational and economic prescribing, as well as dispensing. GPP is the Bible of pharmacists. Good pharmacy practice clearly defines the role of a pharmacist. Prepare, obtain, store, secure, distribute, administer, dispense and dispose of medical products. Provide effective medication therapy management. Maintain and improve professional performance. Contribute to improve effectiveness of the healthcare system and public health.
It's very important to recognize that what are the key components of these good pharmacy practices. Number one is to establish clarity of the prescription. Second is to ensure that that prescription which is generated from the healthcare doctor or the physician is appropriately explained to the patient. The third good pharmacy practice is appropriate storage, maintenance of cold chain and supplies of the medications in the inventory. Beyond this, pharmacists play a very important role in rational economic prescribing, and therefore they make a very critical cog between patient or the consumer and doctor or the healthcare provider in terms of rationality of prescription as well as economics of prescription.
It means that a pharmacist needs to develop himself as a specialist in medication, a companion of healthcare members, a counselor to the patient and a guardian of public health. Pharmacist is the most common health professional whom people meet most commonly due to convenience and easiness. In case of community pharmacy, Pharmacist can be met without any appointment. In India today, there are around 8 lakh pharmacists working in various positions, applying their unique knowledge and skills. Pharmacists have the potential to help our country in facing challenges like increasing disease burden, advent of new diseases, rising cost of healthcare, and non-availability of healthcare providers.
Today we have two types of diseases, acute diseases and chronic diseases. And in chronic care models where people have to take medicines for life, there actually the pharmacist plays a very important role in different stages of the disease, in early disease with lifestyle counseling and nutrition, then in between stage of the disease, then with complications. At every stage of the disease, the pharmacist is there apart from the physician and healthcare provider to handhold the patient, to give the right advice, to ensure that a dispensing of medicines, adherence of medicines, continuity of care, that the medicines are always available in stock. Whenever they are out of stock, he ensures that they are in stock and that continuity of care is maintained. Therefore, in compliance and adherence, pharmacists play a very critical role, and therefore according to me, pharmacists are not just a care provider, they are a long-term care provider.
As the role of pharmacist is transforming, the demand for specialization is evident. Formerly a compounder, an OTC drug seller and a medical store owner will soon be a thing of the past, and new pharmacists will have to play new roles in patient care management as community pharmacist, clinical pharmacist and hospital pharmacist.
Pharmacist is a useful person as far as he is the liaison with all of the healthcare staff which is working in the hospital. Only then pharmacist can be involved as an important member of the healthcare team.
India is a country of youth. We have a wide and large young population, and this group is sometimes very hesitant about approaching a doctor for some common problems. At this point, a pharmacist may play a very good role because the youngster may be comfortable talking to a pharmacist across the counter.
In countries like the US and the UK, pharmacist has a bigger role to play. The pharmacists are patient counselors and drug information providers. Every day, scores of people visit community pharmacies for their healthcare needs. Due to free accessibility and friendly approach, pharmacists are placed at first point of contact in the healthcare system.
Pharmacists today are just not pill vendors but are also caregivers who take personal responsibility for patient outcome. This is especially true in persons seeking nutritional consultancy and a better lifestyle.
World Health Organization or WHO has clearly defined the roles and responsibilities of community pharmacists. The closer professional relationship between the pharmacists and general practitioners is always essential in improving the quality of patient care. Now, there is a shift in the role of community pharmacist even in countries like India. They are now an important part of national health programs. Their duties involve dispensing prescription medicines to the public, checking dosage and ensuring that medicines are correctly and safely supplied and labeled. Pharmacists are legally responsible for any dispensing errors, supervising the preparation of any medicines. Not all are supplied ready-made up by the manufacturers, keeping a register of controlled drugs for legal and stock control purposes, selling over-the-counter medicines, counseling and advising the public on the treatment of minor ailments, advising patients of any adverse side effects of medicines or potential interactions with other medicines or treatments, preparing dosette usually for the elderly, but also for those with memory learning difficulties, undertaking medicine use reviews or MUR, an advanced service to help patients understand how their medicines work and why they have to take them, managing a needle and syringe exchange, monitoring blood pressure and cholesterol levels, offering a diabetes screening service, budgeting and financial management, keeping up to date with current pharmacy practice, new drugs and their uses.
In the last decade or two, the job of pharmacist has become very, very difficult. He is a one-stop shop. He is supposed to be the knowledge king. Every drug, every small thing about the molecule he is supposed to know. And he has to remember generic names, he has to remember trade names, and there is a plethora of medicines. There are millions of medicines. He has to master the pharmacopoeia, he has to master the art of prescriptions, and therefore it has become very, very difficult to manage, educate and communicate with patients. In fact, I feel pharmacist now is one of the main components in healthcare delivery models. And if he is well educated, well informed, then obviously an important cog of the healthcare system will be taken care of.
Community pharmacists in India have to gear up and prepare themselves to transform themselves as medication therapy experts. They have to provide disease management services to patients with chronic health conditions such as diabetes, asthma, hypertension, and high cholesterol.
Pharmacists should have enough knowledge about nutrition to advise patients about do's and don'ts of daily diet and also of some lifestyle intervention. For example, he cannot advise a hypertensive patient to do weight training or take high protein supplements, or advise a patient of obesity just to take weight reducing pills without giving a robust dietary advice.
Hospitals and other institutional facilities such as outpatient clinics, drug information centers and long-term care facilities may be operated by the government or privately. Pharmacists' activities in such facilities may be similar to those performed by community pharmacists. They differ in a number of ways. Hospital pharmacists have a greater role to play in dispensing and inventory management. They have several important tasks to perform. Checking prescriptions to ensure that there are no errors, providing advice on the dosage of medicines and the most appropriate form of medication, for example, tablet, injection, ointment or inhaler, participating in ward rounds, taking patient drug histories and involvement in decision-making on appropriate treatments, liaisoning with other medical staff on problems patients may experience when taking their medicines, discussing treatments with patients' relatives, ensuring medicines are stored appropriately and securely, supervising the work of less experienced and less qualified staff, providing information on expenditure on drugs, preparing and quality checking sterile medications, for example, intravenous medications. More experienced pharmacists may be involved in teaching, both within the pharmacy department and in other areas of the hospital.
Pharmacists can tell facts about food to ensure healthy eating and therefore better health outcomes. Nowadays, designer food, that is nutraceuticals and dietary supplements, have gained importance and have newfound applications. They are considered to provide medical benefits. Pharmacists could explain these products to the patients. I strongly feel the role of pharmacist as primary nutrition guide should be part of their education. Also, it should not just be part of their education, but it should be part of their daily practice once they start working.
Hospital pharmacist has to work in different environment as compared to community pharmacist. But this working atmosphere provides more opportunities to learn and work as a team. A hospital pharmacist in larger hospital and institutional pharmacies has a greater opportunity to interact with others, to specialize and to gain greater expertise. Having access to medical records, is in a position to influence the selection of drugs and dosage regimens, to monitor patient compliance and therapeutic response to drugs, and to recognize and report adverse drug reactions. Can more easily than the community pharmacist assess and monitor patterns of drug usage and thus recommend changes where necessary. Is in a better position to educate other health professionals about the rational use of drugs.
Drugs for particular diseases have to be stored and dispensed in a particular way. Classic examples are injectables for diabetes, like insulin, for GLP-1 analogs like Victoza. These medicines have to be stored in a cold chain. in a cold storage. They often need reconstitution. Sometimes they need to be given by through pens, sometimes through syringe and needles. How to store them, where to keep them, how to take them. These are very important things which pharmacists can play in educating. Apart from that, we have drugs like antibiotics or antimicrobial therapies. Now the therapy duration in antimicrobial therapy is very important. That patient should not miss a dose. Patient should have a clinical microbiological correlation. Ensure that the antibiotics are in tune with the local geography of the antimicrobial resistance pattern. So the pharmacists are also having a very close link, like they have in the US, where they know the microbial flora prevalent in that local geography, and therefore they know which antibiotics are sensitive. So if you want to really prevent true drug resistance, or we want to manage our diabetics better by high-end drugs like GLP-1 analogs like Victoza or insulin, then pharmacists are the most important handholders of our patients. Therefore, I feel an aware patient is going to be aware if he gets patient awareness. But how does he become aware? How does he become empowered? How does he feel confident handling a medicine? Only when a pharmacist empowers him.
Clinical pharmacist practice is in a nascent stage in India, but the future lies here. A paradigm shift is taking place in practice and philosophy. Clinical pharmacists have a pivotal role to play in therapy management. Their primary job is to interact with the healthcare team, interview and assess patients, make specific therapeutic recommendations, monitor patient responses to drug therapy and provide medicine information. Activities of clinical pharmacist may influence the correct use of medicines at 3 different levels: before the prescription, during the prescription, after the prescription.
The pharmacist can even encourage the lady who's just delivered for breastfeeding and talk about the advantages of breastfeeding over other methods of top feeding. So the pharmacists have a very important role to play in this interaction. Many times day-to-day problems, minor issues, they can suggest good over-the-counter drugs which may solve many of the problems. And they can also suggest when the patient actually needs to go and see a physician or when they can be treated with some minor over-the-counter drugs. So the pharmacist may play a bridge-like role between the person or the woman and her gynecologist or her physician.
Pharmacists can make considerable contribution in ensuring adequate nutrition by advising patients about basic food needs, making children, their parents and caregivers about improper food habits and their repercussions, advising on special dietary needs of people with special requirements, for example, people with diabetes or people having food allergies. Participate in school lunch programs and in rural areas, participate in midday meal schemes.
Healthcare interventions can no longer be based on opinion or individual experience alone. Scientific evidence built up from good quality research is used as a guide and adapted to each individual patient's circumstances to ensure safe, effective and economic drug therapy. A clinical pharmacist should perform these activities religiously on daily basis. Medication history review, ward round participation, drug therapy monitoring, treatment chart review, medication administration review, patient counseling and education, monitoring of treatment outcome, therapeutic drug monitoring, adverse drug reaction management, drug information and poison information. Clinical pharmacists should have the knowledge of pharmacotherapeutics, disease process, pharmaceutical products, laboratory findings, along with strong communication skills, drug monitoring skills and drug information and therapeutic planning skills. So they should always be ready to learn through continuing education and interaction with experts in the field.
Pharmacist is expected to know everything. For example, I am an endocrinologist, diabetologist. If patient of mine, I give a prescription for diabetes. They go to a chemist. They need to know which medicines have to be given before food, which have to be given with the first morsel of food, which have to be given after food. If it's insulin, how it has to be injected, how it has to be stored. If they are traveling, what has to be done. So actually the pharmacist becomes the first point contact and has to know the right amount of nutritional knowledge. If he eats less, he has to take less. What is the nutrient interactions with the drugs? All these nutritional knowledge bank has to be taken care by that pharmacist. Also, that pharmacist is supposed to know everything about nutraceuticals. Many a times they need to know that when they are co-prescribing medicines with diabetes with drugs like digoxin for the heart or anticoagulants, then they have to be very, very careful. So actually, when you look at the role of a pharmacist is an educator, empowerer, and also has a lot of compassion. But he has to know a knowledge not only about every molecule, its effects, its side effects, its special precautions, can it be taken in pregnancy, can it be taken in lactation, are there drug-to-drug interactions, are there drug and nutritional interactions.
Women, as you know, are the backbone of the family. Not only the family keeps healthier if the woman is in good health and active and energetic to look after them, this translates into the good health of the society, of the community, and of the nation as a whole. So a good pharmacist, when interacting with a woman at various stages of her life, can really be of great help, because the woman never prioritizes herself. She is last priority. And so when she is interacting with the pharmacist, if they can guide about basic nutrition, basic health guidelines, during pregnancy, if they can inform about nutritional supplements and the importance of taking those supplements for the mother and for the baby, it can go a long way in actually helping maternal health during pregnancy. Also, after childbirth, they can play a huge role in reinforcing the need for vaccination for the child and ensuring the child's good health in early years of life.
Good pharmacy practices are the guiding star for a working or aspirant pharmacist. And to become a star pharmacist, one should have some essential qualities like caregiver, decision maker, leader, manager, communicator, teacher, researcher, and lifelong learner.
This film is an extremely useful methodology for pharmacy people to understand what a respiratory physician wants the pharmacy should do. And if they do it the way I have told, it is a great service they provide to the health system, because a lot of drug related complications, overuse of drug, side effects of the drug can be understood earliest by the pharmacist, because they have good rapport with the patient.
I hope this training video would be helpful not only to pharmacists but also for everyone related to the profession of medical science, because from education to practical situation, everything is closely linked. I wish all pharma professionals a very bright future.
That the prescription translation into the lay language, local geography, local language, education, all this is done most efficiently by an overburdened, overworked chemist or pharmacist in India. And therefore, I feel that the role of pharmacists in India is central to good health of India. And if we really want to have a healthy India, it is important to ensure that our pharmacy practices are at the optimally best.
This training film for pharmacists is really important at the present time, because there is so much unawareness and patients are sometimes concerned about approaching a physician. They are shy or hesitant, and pharmacists can play a great role in information, knowledge, conversation, education, and referring them to a physician who will sort out their problems. So I think this kind of education and knowledge is extremely vital for pharmacists, and this kind of information video should go a long way in improving the education and knowledge of these pharmacists.
Adopt good pharmacy practices to ensure a bright future. Arise, awake, and do not stop till the goal is reached.